People usually charge for consultations, but you get a free Q&A session, so let's go. Part of that's actually a myth, and part of that is true. So as time goes on, gravity basically allows the nose to kind of come down, but also the soft tissue connections that hold that cartilage and skin in place also start to loosen. So you will notice that the nose tends to droop and look a little bit bigger as you get older. Is it actually getting bigger? No. Cartilage really has nothing to do with it. Cartilage doesn't get bigger like bone doesn't get bigger. Not a thing. However, the only thing that you really can do to prevent that from happening is surgery, because with surgery, we're trimming cartilage, we're also suturing things in place. So you can pretty much rest assured that that new structure is not going to change a ton. It will change a bit with age, but nowhere near something that a nose that hasn't had surgery will. Here's the thing, I do like eye creams. There are a few eye creams on the market that actually do something. They're formulated a bit differently, they're specific for the under eye skin, and they have amazing antioxidants or ingredients that treat things like fine lines and wrinkles, a little bit of pigmentation. But the thing about eye creams is that every product on the market now is marketed for the eye. Every brand is coming out with eye creams, and not all of them do stuff. You can take your moisturizers, your serums, and put them right under the under eye for most of the time. Retinoids, you do have to be careful because your eyelid skin is thinner. However, sometimes eye creams are just a money grab. They're a lot more expensive and they don't always do something. So it's not that I don't like eye creams. I do love them, but you just have to pick a good one. This is an amazing question, and we love Amy Chang. So the challenge is that nothing replaces or even remotely mimics a facelift. So you're in two different categories. If you have a little bit of volume loss or you want to enhance things like your cheeks or your lips, then you're in the filler bucket. But if you want a sharper neck and jawline and things to be uplifted, then you're in the facelift bucket. These are two different types of patients, two different results. If you cloned yourself and one just did fillers and one did a facelift, these would look like completely different people. So a better thing to think about it is, what are the things that you're concerned about? And come into a professional, we can do the consultation and give you all the options available to you. Fillers do have a place. I think they get a bad rap, but realistically, if you're looking for a long-lasting contoured neck and jawline, it's surgery. There's just no way around it. Textured skin. That's a hard one. So if you have textured skin and you've used really nice skincare, you are doing some things to help minimize the texture, but I'm telling you that once you're past just routine skin maintenance and maybe a little bit of brightening, you really got to come in for procedures. And the reason is that texture can be from acne, it can be from dead skin that's accumulating on the surface of the skin. It can be from lots of different things. So it takes an expert to look at your skin and determine what that is, and then come up with a plan. And usually that involves some combination of chemical peels, microneedling, lasers, something to help resurface the skin depending on your skin type and your concerns. Skincare is great and you do need it for maintenance. It's just like brushing your teeth, but every year, a couple of times, you got to go into the dentist, and that sometimes requires a bigger procedure. Here's the real story. I don't recommend anything for facial symmetry or facial asymmetry. And here's the thing. You are asymmetric, I'm asymmetric, Beyonce is asymmetric, we're all asymmetric. And so the better thing to do is to improve symmetry, but not ever chase perfect symmetry. We will never be perfectly symmetric. And it depends what's actually creating the asymmetry. For example, if you have a droopy eyelid, that can be something called ptosis, and that requires a surgical procedure or an eyelid drop. But if you're worried about lots of different points of asymmetry on your face, your brows, your nose, your lips, little things like fillers can help, but it's better to just be happy with what you have, make small tweaks to improve your confidence, but that's it. Remember, you will always be asymmetric despite everything we do in cosmetic procedures. These just improve your general appearance. They will not make you perfect. These answers are all for you, so keep the questions coming, leave them in the comments, and I'll see you next time.